Lip and mouth piercings are a popular form of self-expression with a wide array of styles and placements available. Understanding the different types, healing processes, and necessary aftercare is crucial before getting a piercing. Standard labret. The standard labret piercing is positioned centrally below the lower lip and above the chin, creating a balanced focal point for the face. As one of the most versatile and popular lip modifications, this classic piercing accommodates various jewelry styles, including studs and rings, allowing wearers to easily change their look without additional piercings. On a pain scale of 1 to 10, the labret ranks around a 4. Healing time typically ranges from 6 to 8 weeks. Side labret. Unlike its centered counterpart, the side labret is deliberately placed off-center below the lower lip, creating an asymmetrical aesthetic that adds character to the face. This variation offers a subtle yet distinctive look that can be customized to either the left or right side, according to personal preference or facial features. Pain level is similar to the standard labret at around 4 out of 10, with healing taking approximately 6 to 8 weeks. Lobret. The lobret piercing sits noticeably lower than the standard labret, usually positioned off to one side of the chin area. Due to its lower placement on thicker tissue, this more dramatic variation typically requires larger gauge jewelry for stability and comfort, making it a bold statement piece for piercing enthusiasts. Pain level is slightly higher than standard labrets at 5 out of 10 due to thicker tissue with healing time of 6 to 8 weeks. Vertical labret. Unlike traditional labrets that enter the mouth, the vertical labret creates a striking appearance by entering below the lower lip and exiting through the lip itself, showcasing both ends of the jewelry. This unique orientation potentially reduces dental concerns since no part of the jewelry makes contact with the teeth or gums. Pain level is moderate to high, 5 to 6 out of 10, as it pierces through sensitive lip tissue. Healing time is 6 to 8 weeks. Ashley, the Ashley piercing, also known as the inverse vertical labret, is one of the few lip piercings that actually passes through the center of the lower lip itself. Unlike the vertical labret, the exit hole is visible on the inside of the mouth rather than the outside, creating a minimalistic, single-point look on the lip surface. Pain level is moderate at 5 to 6 out of 10, with complete healing taking 12 to 16 weeks, 3 to 4 months. This piercing requires extra attention during healing due to its location and potential for dental damage. Monroe. Named after the iconic actress, the Monroe piercing is strategically located on the upper left side of the lip, precisely mimicking Marilyn Monroe's signature beauty mark. This elegant piercing typically features a flat-backed labret stud and creates a subtle yet sophisticated beauty mark appearance that pays homage to classic Hollywood glamour. Pain level is moderate at 4 to 5 out of 10. Healing time ranges from 6 to 12 weeks, with most people fully healed after 6 weeks. Madonna. The Madonna piercing is positioned on the upper right side of the lip, drawing inspiration from the famous singer's distinctive facial mole. Similar to the Monroe but placed on the opposite side, this piercing creates a striking asymmetrical look that draws attention to the upper lip while adding character to the face. Pain level is comparable to the Monroe at 4 to 5 out of 10, with healing time of 6 to 12 weeks. Medusa, also known as philtrum, centered perfectly in the Cupid's bow groove between the nose and upper lip, the Medusa piercing creates a bold, symmetrical focal point on the face. This striking central placement highlights the natural contours of the philtrum and adds an element of intrigue to the upper lip area. Pain level is moderate at 5 out of 10. Initial swelling subsides in 1 to 2 weeks, with complete healing taking 6 to 8 weeks. Gestrum. The gestrum creates a distinctive vertical line by entering the upper lip and exiting through the philtrum, with both ends of the jewelry remaining visible. This unique variation of the Medusa piercing showcases the curved barbell or specialized jewelry that follows the natural contour of this facial feature. Pain level is moderate to high, 5 to 6 out of 10, due to the vertical nature through sensitive tissue. Healing time is approximately 8 to 12 weeks, according to sources, with exterior healing taking 6 to 12 weeks and interior healing up to 6 months. Snake bites. Snake bites consist of 2 symmetrically placed piercings on either side of the lower lip, creating a balanced, fanged appearance that frames the mouth. These paired piercings can be adorned with matching rings or studs, offering versatility and styling options while maintaining their distinctive serpentine inspiration. Pain level is 4 out of 10 for each piercing, but the cumulative effect makes the overall experience more intense. Healing time is 6 to 8 weeks. Spider bites. Spider bites feature two closely placed piercings positioned side by side on one side of the lower lip, creating an asymmetrical arrangement that draws the eye. This edgy, distinctive look creates visual interest through the proximity of the two piercings, which are typically adorned with matching jewelry for a cohesive appearance. Pain level is 4 out of 10 for the first piercing and 5 out of 10 for the second, due to increased sensitivity. Healing time is 4 weeks to 3 months. Angel bites. Angel bites consist of two symmetrically placed piercings on either side of the upper lip, creating a celestial balanced appearance that elegantly frames the upper mouth. These heavenly named piercings create a delicate yet striking look when adorned with matching jewelry, drawing attention upward on the face. Pain level is 4 to 5 out of 10 for each piercing. Healing time is 2 to 3 months. Dolphin bites. Dolphin bites feature two centered piercings placed close together below the lower lip, creating a unique symmetrical arrangement that draws attention to the center of the mouth. The distinctive double piercing effect creates visual interest through proximity while maintaining perfect balance across the face. Pain level is 4 out of 10 for the first piercing and 5 out of 10 for the second. Healing time is 6 to 8 weeks. Cyber bites. Cyber bites combine a Medusa and central labret piercing to create a striking vertical alignment with piercings both above and below the lips. This modern combination forms a perfectly balanced vertical line down the center of the face, creating a bold, futuristic aesthetic that has become increasingly popular among piercing enthusiasts. Pain level varies from 4 to 5 out of 10 for each component. Healing time is 6 to 8 weeks for the labret portion, while the Medusa portion takes 2 to 3 months. Canine bites. Canine bites incorporate 4 total piercings, 2 on the upper lip and 2 on the lower lip, creating a comprehensive framing effect around the entire mouth. This elaborate arrangement allows for creative expression through multiple points of adornment that can be coordinated with matching or complementary jewelry styles. Pain level ranges from 4 to 5 out of 10 for each individual piercing, with cumulative discomfort. Healing time is 6 to 8 weeks. Standard tongue. The standard tongue piercing passes vertically through the center of the tongue, positioned to avoid major blood vessels while creating a classic oral modification. This popular piercing typically features a straight barbell that can be downsized after initial swelling subsides, allowing for comfortable wear once fully healed. Pain level is surprisingly low at 3 to 4 out of 10, though the discomfort stems more from the days following the procedure. Healing time is relatively quick at 4 to 6 weeks. Venom piercings, also known as frog eyes. Venom piercings feature two horizontal piercings placed side by side through the tongue, creating a distinctive appearance when the tongue is extended. These dual piercings require precise placement by an experienced professional to avoid major blood vessels while maintaining perfect symmetry. Pain level is relatively low, similar to standard tongue piercings. Healing time is 4 to 6 weeks. Tongue web, also known as frenulum linguae. The tongue web piercing passes through the thin frenulum tissue beneath the tongue, creating a hidden modification that's only visible when the tongue is lifted. This discrete piercing typically heals quickly due to the thin tissue involved, though it carries a higher risk of migration and rejection over time. Pain level is relatively low at 3 out of 10, with the piercing itself being pretty painless. Healing time is quick at 2 to 4 weeks. Horizontal tongue. Unlike the standard vertical placement, the horizontal tongue piercing runs sideways through the tongue, creating a unique orientation that stands out from conventional tongue modifications. This less common approach requires careful placement to navigate around the major blood vessels and nerves that run longitudinally through the tongue. Pain level is moderate to high at 5 to 6 out of 10. Healing time is 4 to 6 weeks. Tongue tip. The tongue tip piercing is placed at the very front end of the tongue, creating a highly visible modification that immediately catches the eye when speaking or eating. This forward placement affects speech more noticeably than standard tongue piercings and requires specialized jewelry that won't interfere with the dense concentration of sensitive nerve endings in this area. Pain level is high at 6 to 7 out of 10 due to nerve concentration. Healing time is 4 to 6 weeks. Snake eyes. This unique piercing is a curved barbell that runs horizontally through the tip of the tongue, creating the appearance of two separate piercings when viewed from the front. It's described as mostly painless other than a mild amount of pressure. Healing time is similar to other tongue piercings at 4 to 6 weeks. Multiple tongue. Multiple tongue piercings involve three or more carefully arranged perforations that create geometric patterns, such as triangles or diamonds, across the tongue's surface. These elaborate configurations require meticulous planning to ensure proper spacing and alignment, creating unique visual effects that are revealed when the tongue is extended. Pain level varies from 4 to 6 out of 10, depending on placement. Healing time is 4 to 6 weeks for each piercing. Smiley, also known as the frenulum of the upper lip. The playfully named smiley piercing passes through the thin tissue connecting the upper lip to the gums, creating a surprise element that's only visible when smiling broadly. This hidden piercing uses small, curved jewelry, but requires careful consideration due to its potential for causing dental damage through regular contact with the front teeth. Pain level is low to moderate at 3 to 4 out of 10. Healing time is relatively quick at 4 to 6 weeks. Frowny. The frowny serves as the lower counterpart to the smiley, with the piercing placed through the frenulum tissue, connecting the lower lip to the gums below. This discrete modification remains hidden during normal expressions, becomes visible only when the lower lip is pulled down, creating a surprising element of personal expression. Pain level is low to moderate at 3 to 4 out of 10. Healing time is 4 to 6 weeks. Gum, also known as scrumper, the rare and controversial gum piercing, sometimes called a scrumper, passes directly through the gum tissue above the front teeth, creating a unique but potentially problematic oral modification. This uncommon piercing carries significant risks of gum recession, infection, and dental complications, making it one of the more contentious choices among oral modifications. Pain level is high at 7 to 8 out of 10. Healing time varies significantly, but typically takes 8 to 12 weeks. Uvula. The extremely rare uvula piercing passes through the hanging tissue at the back of the throat, representing one of the most challenging and specialized oral modifications available. Performed by only a handful of piercing specialists worldwide, this advanced piercing carries significant risks related to swallowing difficulties and gag reflex complications. Pain level is extremely high at 8 to 9 out of 10. Healing time is approximately 2 weeks, according to sources, though it can cause throat soreness during healing. Cheek dimple piercings. Cheek dimple piercings pass through the facial tissue where natural dimples would form, creating permanent dimple-like indentations that frame the smile. These distinctive piercings require longer barbells during the initial healing phase to accommodate the significant swelling that occurs in this tissue-dense area of the face. Pain level is moderate at 5 out of 10, said to hurt less than your cartilage. Healing time is longer than most facial piercings at 8 to 12 weeks. Shark bites. Shark bites incorporate 4 piercings arranged as 2 pairs on each side of the lower lip, creating a dramatic framing effect that encircles the lower mouth area. This elaborate arrangement allows for creative jewelry combinations across the 4 points, creating a bold, predatory aesthetic that commands attention. Pain level is 4 out of 10 for each individual piercing, with cumulative discomfort. Healing time is 6 to 8 weeks. Dahlia bites. Dahlia bites combine traditional corner-of-mouth dahlia piercings with additional lip piercings, creating an extensive facial modification that transforms the entire mouth area. This comprehensive approach to oral piercing creates multiple points of adornment that can be styled with coordinating jewelry for a cohesive, dramatic effect. Pain level ranges from 5 to 6 out of 10 for each component. Healing time varies from 8 to 12 weeks, with the dahlia components taking the longest. Vampire bites. Vampire bites feature 2 strategically placed piercings on the upper lip that perfectly frame the canine teeth, creating a subtly vampiric aesthetic that plays on supernatural themes. These carefully positioned piercings draw attention to the canine area of the mouth, especially when adorned with fang-like jewelry or pointed ends that enhance the mythological reference. Pain level is 4 to 5 tenths for each piercing. Healing time is 6 to 8 weeks.